You've, you're known for expertise across cataract, refractive surgery, corneal care, glaucoma, and even medical retinal procedures. So, how do you balance being multi-speciality while maintaining depth in each area?
That's a very good question. I would not call it being a multi-speciality in that sense. I would just call it like what we call as a comprehensive ophthalmologist, right? That that to know a bit about everything. Because it's very important to recognize that the patient does not always come with problems neatly divided into one box. A cataract patient can have glaucoma, a glaucoma patient can have a diabetic eye disease, a patient with a corneal disorder can also have a refractive correction. And the way I approach patients, if you just take a step backwards, right, and you listen to them, these patients have chronic diabetes. Some of them have had a recent history with cancer surgery, and now they are so afraid of hospital visits, and now they are so angry that after the entire stint of cancer, now somebody is diagnosing them with cataracts or glaucoma, and they are so anxious, so vulnerable in that state. So that's how a patient is. A patient is just not an eye disease in that sense. It has its own backstory. The relationship with their parents, we get to hear about everything. Their in-laws, their patients. If you let them talk, they tell you so much, not just about their eyes, but about their entire life, right? So for this, you need to understand the correlation between, let's say, diabetes and eye care and the eyes. You need to know the correlation between a history of cancer and its treatment and how can that affect the eyes. You need to know that if a patient has both cataract and glaucoma, what will you treat first?